Hi everyone, I am Michelle Jane Dunyo, and in behalf of the Group 2, I am the one to discuss the typical and atypical development of the newborn and medically compromised births. To fully understand, let us have first the difference between typical and atypical development. When we say typical development, it is a normal progression by which children change as they grow older by acquiring and refining knowledge, behaviors, and skills. While the atypical development is when the development of the baby doesn't follow the normal course. It could include things like learning and social disabilities and disorders. Alright, now let's focus on the typical and atypical development of a child that would begin with a 2 months old baby. We have here the social and emotional development of a child. So normally when a baby is typically developed, he or she begins to smile at people, can briefly calm him or herself, may bring hands to mouth and suck on hand, and tries to look at parent. In an opposite manner, a baby doesn't smile at people when he or she is not typically developed. For the language and communication development, normally a baby makes gurgling sounds and turns head toward sounds.
Ooh, what is that noise we hear? What is that? Is that a rattlesnake?
Otherwise, when a baby is not typically developed, he or she doesn't respond to loud sounds and doesn't smile at people. And for the cognitive, learning, thinking, problem-solving development, normally a baby pays attention to faces, begins to follow things with eyes and recognize people at a distance, and begins to act bored, cries, fussy, if activity doesn't change. Otherwise, a baby doesn't watch things as they move if he or she is not typically developed. And for the baby's movement and physical development, normally a baby can hold heads up and begins to push up when lying on tummy and makes motor movements with arms and legs. And if the baby's development doesn't follow the normal course, then he or she can't hold heads up nor push up when lying on tummy. And for the 4 months old baby's social and emotional development, normally a baby would smile spontaneously, especially at people, likes to play with other people, and might cry when playing stops, and copies movements and expressions like frowning and smiling. On the other hand, a baby doesn't smile at people when he or she is not typically developed. And for the language and communication of a baby, normally he or she begins to babble with expressions, and cries to show pain or hunger. Otherwise, when a baby is not typically developed, he or she doesn't call or make sounds. And for a baby's cognitive learning, thinking, problem solving, normally he or she responds to affection, reaches for toy with one hand, and uses hand and eyes together, such as seeing a toy and reaching for it. On the other hand, a baby has trouble moving one or both eyes in all directions when he or she is not typically developed. For the baby's movement and physical development, normally a baby recognizes familiar people and things at a distance, hold head steady and supported, pushes down on legs when feet are on a hard surface, may be able to roll over from tummy to back, and can hold a toy and shake it and swing it and dangling toys, and when lying on stomach, pushes up to elbows. And if the baby is atypically developed, he or she doesn't bring things to mouth and doesn't push down with legs when feet are placed on a hard surface. Moving on to the 6 months old baby's development. For his social and emotional development, normally he or she knows familiar faces and begins to know if someone is a stranger, responds to others people's emotion and often seems happy, and likes to look at self in a mirror. Otherwise, a baby shows no affection to caregivers if he or she is atypically developed. For the language and communication of a baby, normally a baby responds to sounds by making sounds, strings vowels together with bubbling o, and likes taking turns with parent while making sounds, and responds to own name, and makes sounds to show joy and displeasure, and begins to say consonant sounds like jabbering with M and B. In an opposite manner, a baby doesn't make vowel sounds like o, and doesn't laugh or make squealing sounds, and doesn't respond to sounds around him or her when he or she is not typically developed. For its cognitive learning, thinking, problem solving, normally a baby looks around at things nearby, brings things to mouth and shows curiosity about things and tries to get things that are out of reach. And if a baby is not typically developed, he or she has difficulty getting things to mouth and doesn't try to get things that are in reach. For the movement and physical development of a baby, normally he or she begins to pass things from one hand to another, rolls over in both directions from front to back and back to front, begins to sit without support, and when standing, supports weight on legs and might bounce, and rocks back and forth, sometimes crawling backward before moving forward. Otherwise, when a baby is atypically developed, he or she seems very stiff with tight muscles, seems very floppy like a rag doll, and doesn't roll over in either direction. Moving on to the 9-month-old baby's development. For his social and emotional development, normally he or she may be afraid of strangers, may be clingy with familiar adults, and has favorite toys. Otherwise, when he or she is not typically developed, he or she doesn't seem to recognize familiar people. For its language and communication, normally a baby understands no and makes a lot of different sounds like ma, 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 and ba, 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 ba. Copies sounds and gestures of others and uses fingers to point at things. On the other hand, a baby doesn't babble mama, baba, dada when he or she is not typically developed. For its cognitive learning thinking problem-solving development, normally a baby watches the path of something as it falls, looks for things he or she sees you hide, plays peekaboo, puts things in their mouth, moves things smoothly from one hand to another, picks up things like cereal O's between thumb and index finger. On the other hand, a baby doesn't transfer toys from one hand to another, doesn't play any games involving back and forth play, doesn't look where you point, and doesn't respond to own name when he or she is not typically developed. The movement and physical development of a child. Normally, a baby stands holding on, can get into sitting position, sits without support, pulls to stand, and curls. On the other hand, a baby doesn't bear weight on legs with support and doesn't sit with help when he or she is not typically developed. And that are some of the typical and atypical development of the newborn and medically compromised births. Once again, I am Michelle Jane Dunyo, your discussant from Group 2.